Hi, Jamie.
Hi.
Hi, I'm Summer. I'm a student. I was hoping that I could get SBAR on your student, or your patient rather.
Sure. We have Shanana O'Connor in room 231. She's a full code. Her allergies are trimethoprim sulfamethoxazole. She's 34 years old. She's an African American female who has been admitted to the med-surg unit from the emergency department with a fever. She's a type 1 diabetic, and she also has end-stage renal disease, which was diagnosed a year ago and is undergoing hemodialysis. She has elevated blood glucose readings and decreased appetite for the past few days and minimal urine output. She has a graft infection 3 months ago, which was resolved after antibiotics. She has a history of recurrent UTIs. She has a history of renal failure secondary to diabetic neuropathy and hypertensive nephrosclerosis. She used to be a smoker, but quit 2 years ago. Her last assessment revealed that her temperature was 101.1, her respiratory rate was 20, her heart rate was 95, blood pressure was 138 over 78, and O2 is 96. She reports a pain level of 4 and numbness and tingling in her lower legs. She has a regular rhythm, S1, S2 are present. She has slight non-pitting edema in lower extremities. Her abdominal is soft and non-tender with bowel sounds in all 4 quadrants. She's on a renal diabetic diet, and her last blood glucose level was 155. Her skin is warm and it's intact. She reports recent decrease in urination and volume of urine. Her urine results have come back, and she has cloudy, concentrated, darker urine. But she also denies pain or difficulty while urinating. Her white blood cells are elevated at 15. We also ordered a CBC and the urine culture. We're going to watch for the labs. We have follow precautions and make sure she's a call light because of the tingling in her lower extremities. She has an order to notify the doctor of her temperature if it rises, and we're also going to monitor her pain level.
Okay, cool.
Lots of stuff.
And why is she receiving the medication today, and what action does it have on the body?
She's ordered the Promaxin, and that's used because we suspect that she has a UTI, and that's going to be a broad spectrum antibiotic, and we want to treat her for the UTI.
Okay, and how does the antibiotic work?
It destroys the bacteria cell walls.
Oh, okay. When would you question administering the medication?
We would question it if she wasn't undergoing hemodialysis. We would also question it if she had any allergies to penicillin, carbapenems, or cephalosporins.
Okay. Does the medication have a therapeutic level?
No, it does not.
Okay. And what vital signs would you monitor?
We're going to assess her heart rate, her blood pressure, and we also want to monitor her temperature since she had a fever.
Okay, gotcha. And what physiological parameters should be monitored when the medication is being administered?
We want to look for any signs of allergic reaction, the anaphylaxis, and shortness of breath, or any flushing in the mouth.
Gotcha. What interventions would be taught to the client to ensure that the medication is administered safely in the hospital setting?
We just want to make sure that she reports any signs and symptoms of her of itching, redness, oral flush. We want her to tell us if the IV site has become inflamed or red or it irritates her.
All right. And then what would interventions would be taught for taking the medication safely at home?
We just want to make sure that she takes her antibiotic for the whole duration, even if her symptoms subside, just to keep taking it as ordered.
Okay. What are the side effects and potential adverse reactions?
Nausea, vomiting, diarrhea, and also the super infection. She can get like an oral flush.
Okay. And will you know if the medication is effective? Or how will you know, I'm sorry, if the medication is effective?
If her temperature goes down, if her urine culture comes back with no bacteria, and if her white blood cell count has gone down to the normal range.
Okay, gotcha.
Alright, we're going to go in the room now and give her her medication. Ma'am? Hi, my name is Jamie. I'm going to be your nurse today.
Hi, Jamie.
Can you tell me your name and date of birth?
My name's Janae O'Connor, and I'm 34 years old.
Okay. And do you have any allergies?
I have an allergy to trimethoprim sulfoxazole.
Okay. I'm just going to verify that against the MAR. Alright. And since I don't have a scanner, can you just read off to me the numbers on your ID?
Sure, 842-334-3660.
Today we're going to be giving you the fluids of normal saline. Since we don't have a scanner, I'm going to just type it in. Okay, and then just want to show you since you're shadowing me. When you have the right patient ID and the medication and everything's verified, it will come up with a green light.
Oh, okay, I see that green light.
Okay. So we're gonna check the back for any tears. We're gonna check the clarity. We're gonna check that there's obviously no holes. Expiration date. We're gonna check the 5 rights, the right time, the right amount, the right medication, the right route, and the right patient, which is all verified because we have the green light. Alright. I'm going to put my glove now and flush her IV. I don't know if we have any questions.
Oh, I'll go get you one. Hang on just a second.
Here. Oh, no, there's a bowl there.
You got it?
Oh, you have one?
Yeah. Thanks. All right. I'm going to flush the line before I hang up the primary bag. I'm going to take an alcohol swab, clean the port. Take out the tubing. Spike the bag. Make sure it's clamped, which it isn't. And since we don't have a pump, we're going to use the Dialaflow. And this is the primary bag of it, so we're going to do 30 milliliters per hour. So we're going to make sure everything's closed so we can prime the line. And we're setting this one to 30. If I can just have the student nurse verify.
Oh, that's 30.
Okay. Then we're gonna open this back up. So it's full. Now we're going to hang the piggy back. I'm going to document that I hung the primary bag. Alright, and then since I don't have a scanner, can you read the numbers to me on your wristband?
Yeah. It's 842.
Sorry. Okay. 842.
334. 366.
366.
0.
0. Okay. And then I'm going to type in the medication barcode since we don't have the scanner as well. Alright, and then since we have the right patient and the right medication, I'm just going to show you that we have the green light. Yeah, you can
Yeah.
kind of see it.
Yeah, you can see the green light, or I can. Yeah.
Okay, just make sure you can see the IV. Turn the computer a little bit.
Oh, just kidding.
Yeah.
Boop.
Sorry. So now that we have the green light, I'm just going to double check the bag, make sure there's no holes, there's no tears, the expiration date, we have the right patient, the right time, the right route, amount, and medication. Now I'm going to wash my hands again and put gloves on. And now that we're hanging a piggyback, I'm going to hang the primary bag a little bit lower so that gravity takes the piggyback first. Make sure it's nice closed before I spike it. Now we're going to prime this. We're going to disconnect it all or just turn it off. And we'll rinse it. Alcohol swab the port. Open this up, and we're going to set the dilute flow to 100 milliliters per hour. Can you just verify for me that it's 100?
100, perfect.
Alright, so I'm just going to make sure dropping. I'm gonna label the tubing. I'm gonna put my initials and the date and time. Alright, and then I'm going to documents. Alright, do you have any questions for me?
Yeah, I don't think so.
Okay. Just make sure that if you call the doctor or call me if you have any swelling or redness or irritation. One thing that you're gonna look for if you have, if you have an allergic reaction.
An itchy, redness, nausea.
Okay. Yeah. If you have any of those symptoms, just call us immediately.
Okay.
So we can rule that out. I'm gonna put your call light in reach. I'm gonna lower the bed and then put your tray table also by your side. Just let me know if you have any questions.
Okay, great, thank you.
Alright, and now I'm going to wash my hands. We're gonna leave the room.
Oh, okay. Jamie, I just have a couple of questions. Were there any pertinent pieces of information that you reviewed before administering the client the medication?
Yes, we checked her vital signs and made sure that everything was normal before we administered. We also made sure that she wasn't allergic to the medication that she was given, and we reviewed her white blood cell count and made sure that it was safe to administer.
Okay. Did the information affect your decision to administer?
Yeah. I wouldn't have administered it if she wasn't undergoing hemodialysis. I also wouldn't have given it to her if any of her labs were abnormal or if she had any allergic reactions or allergies to this medication.
Okay, and did any of that information affect how you administered it?
Well, since everything was normal,